好，各位观众，大家好，今天是5月10号，星期一，我们为大家带来新冠疫情 BC 省的最新的新闻简报。照理今天是周一，会向大家汇报3个时间段。那么上个礼拜五呢是书面的是722例新增，略微有点增加。上个礼拜每一天都是600多，那么到了礼拜五呢是722例。今天到底是多少不知道，我们拭目以待。那么他说礼拜2、礼拜3都是3点钟左右给书面报告。那么礼拜4呢，会到也是礼拜4也是准时出来。好，那么首席医官 Bonnie Henry， 他今天耳环那个口罩把口罩弄啊。
Thank you and good afternoon. Today, we're reporting on 3 periods over the past weekend. From Friday to Saturday, we had 596 new cases of COVID-19 diagnosed in British Columbia. Saturday to Sunday, 605 new cases. And in the last 24 hours, 558 new cases of COVID-19 diagnosed. That brings a total of 1,759 people diagnosed with COVID-19 over the weekend, and our total in British Columbia to 136,100 people. Of the new cases, 325 are people who live in the Vancouver Coastal Health Region, 1,201 are people living in the Fraser Health Region, 50 are people living on Vancouver Island Health, 131 people are in Interior Health, and 52 are people in the Northern Health Unit. We now currently have 6,140 active cases around the province, of whom 415 are in hospital. 150 people in ICU or critical care. And 128,139 people have recovered from COVID-19.
都下来了啊，下降人数，那个住院人数和重症监护都下来了。
We have no new healthcare
没有新的
长期护理员爆发。declared at the Sunrise
又有一个官方宣布结束疫情，在菲沙。
And outbreaks have been declared over at the Surrey Memorial Hospital and Dufferin Care Centre. This leaves us with 3 active outbreaks in long-term care, assisted living or independent living, and 2 in acute care facilities.
那么现在只有3个爆发2个。
Sadly, over this past weekend, we've lost another 20 people.
20例死亡。哎呦。
Bringing the total number of people who've died in our province to 1,622. As always, our condolences and our thoughts and prayers are with the people who have lost a loved one, with their care providers, and with their whole communities. We know how challenging it is to have to mourn during this difficult time. I did want to give a breakdown of the age ranges of people who passed away this weekend. Sadly, it is again overrepresented by seniors and elders in our community, with 15 of the 20 people who died this past weekend being over the age of 70.
70岁以上的15个。
15 over the age of 70 entirely, 5 of those 15 people being seniors in our 80 to 89.
15个里边有5个是80到89岁，都是长期护理院的。
We've had 2 younger people,
还有2个年纪轻的，40岁左右的，40多岁的
and 2 people in their 50s.
还有2个是50多岁的。
And having an age group doesn't represent.
那么他说年龄阶段不能代表个例不能代表一些共性。但是这个是告诉大家我们一定要认识到这个病毒的可怕性我们的还没有到了全体免疫的程度这个但是呢始终记住我们老年人是最受攻击的。
We've delivered 2,159,103 doses of all 3 COVID-19 vaccines in BC. And
2159300多例了这个是疫苗这个已经是快50%左右的，差不多50%了这个是也是一个很了不起的这个进步，所以这个也是希望大家能够注册的赶紧去注册所以我们希望能够把所有的全省的人尽快的第1针打完了之后尽快启动第2针。
Get Vaccinated website and register.
所以希望大家能够上各种我们的网站来注册。
This ensures your dose is reserved.
那么如果你注册了，才能保证你能够及时施打疫苗。所以我们也能够尽快的部署疫苗给你。
Before the registration system began in early April, we ask you to take a few minutes to get registered today. If you received your first dose at a pharmacy, it's also important that you go on, get vaccinated, and make sure you're registered there as well. And if you're already registered, I ask you to please encourage and help your friends and family.
所以他也是说到了，就算你注册了，没有注册的都去注册。如果你注册了，也鼓励你的周围的朋友、亲戚也去注册。所以这样的话呢，能够让大家能够我们那个部署疫苗更加快捷有效。那么同时呢，我们疫苗会越来越多的到来。那么现在呢，从这个40岁以下的人都可以来预约了。那么现在呢，18岁以下的也都可以了。
Can book their vaccine starting later today. Text and email alerts will be going to everyone who is registered.
所以你们可以发短信给我我们可以发短信或者是 email 通知你如果你到了时间了，我们就会通知你。
Understanding the progression of this pandemic and knowing the risks for our loved ones.
所以他也是知道了，就是全球流行病以来，大家对这个病毒的了解越来越多。那么同时呢，我们也搞清楚那个对我们的生活周围的朋友的冲击我们的公卫系统也在积极的监测和保护大家。那么我们呢，也是在我们的公卫系统一直在收集各种各样的数据来看这个，把所有的数据都公布在 BC 的 CDC 网站上。那么所以呢，也确保大家能够看到我们所有的采集下来的数据那么我们每天 BC 省的疫情是怎么一个发展情况。所以我们也通过这些数据呢，通过各种各样方式，比如我们像这样的新闻简报，或者是每天的这个书面的报告这样的话呢，都给大家能够及时的分享给大家。那么这样的话呢，也是可以看到这个住院率年龄分布还有这个阳性率等等，所以这个都是很重要的一些信息那么你们可以到我们的 BC CDC 网站上都能够去看到。
Along in that section, you can look at all of the comparisons.
我们还有一个在这个网站上还有一个环节，就是各种各样的比较我们 BC 省和加拿大的比较包括了测试率包括了这个各个地方的各个省的测试率怎么样这样的话对大家都能够帮助我们能够了解我们省所处于的环境所以这个地步在哪里那么同时呢，我们每个月都会有更新这个模型分析。那么这些数据呢，都在网上都公布了都是我们的公卫系统的科学家们医护人员采集以及做的研究人员做的。那么我们每个礼拜呢，都从这个从去年1月份到现在为止，我们每个公卫系统的每个礼拜都会开这个会议，对有关数据做一些数据分析总结
The level of data and the numbers of people who've been affected.
因为数据有各种各样的数据，那么这个数据到哪一层级、哪一个面我们都会有一个详细的分析，哪一个分类，哪一个总结。所以呢，我们都及时公布出来我相信这个 Bonnie Henry 今天为什么讲这些话，我估计就是上星期的周末这个主流媒体有报说那个 BC 公卫系统有隐瞒疫情的嫌疑，有这个瞒报欺报的这个嫌疑，所以呢，今天他就其他不说，就说了这个数据分享透明公正
as cases surged again in this third wave, we've been able to
那么他现在已经重点讲了这个第三波了啊，我们这个第三波这个
and now very recently on immunization rates by
那么现在新的又加了一个免疫力啊，这个数据又是新的，之前没有的，就是所谓的免疫力，就是打过了疫苗之后产生的这个免疫力啊。那么他们也是采取各种各样的数据来呈现给大家，能够最准确的描述我们省的 BC 省的免疫的情况。那么我们也会持续的更新，我们也会持续的这个不断的这个来改进我们的这个更新我们的这个免疫地图啊，来看大家可以看啊我们的社区、我们的年龄分布的免疫的情况啊，接种疫苗的情况。那么同时呢，每一个人的个人的隐私信息，我们从来不会泄露出去，我们也不会去牺牲每个公民的这个个人的隐私信息来获得大家的这个理解或支持，这个是不允许的。同时呢，我们会把大数据所有该公布的都公布。那么我也鼓励大家来关注我们的 BC 的 CDC 网站啊。那么礼拜三的话呢，你们就可以看到，一般都是礼拜三更新一下都可以看到那些大大小小的社区或者是偏远对于农村地区他们的这些社区里边的这个疫苗的接种情况。我们所有做人的这个做法，主要是给大家告诉大家，我们所决策的每一个决策，所做出的决策如何的更好的按照我们 BC 省自己的这个特点来做出最有利的、最科学的决策。
These include things like race-based data, disaggregated data based on race, on workplace data,
那么同时呢，也是学校的数据工作场所的数据我们都及时收集了，都公布给大家这个也是我们每个月的模型分析做的也要根据这些数据来每个月更新我们的模型分析。同时我们也会收集其他的更重要的一些重要的数据，也是通过我们日常工作来收集。
Data is through our Speak survey, where we understand the impact not just of COVID-19, but also the measures that have been put in place to control the pandemic on different communities, different racial groups.
今天伯尼医生讲了这么多大家好像觉得突然之间为什么讲了这些我觉得事出有因，也就是上星期六有一个媒体就说到了，好像说上周五、上周六说到了他们故意隐瞒这个谎报、瞒报有这种嫌疑。我相信伯尼医生一定注意到了，所以今天在讲这些事情。
We've developed a strategic research advisory board that has led the coordinated response of a number of different research networks across this province that has put BC in a really good place to understand things like which medications work best. We have a critical care group. We have a group that's focused on looking at the impacts of the pandemic other than the COVID-19. We've looked at schools. We've looked at the unintended consequences, as we've called them. So these networks continue to be active and to share data. We know that the modelers that are part of our teams and part of these networks are informing the modeling that we present to you at least monthly, as we have since January of last year, and we will continue to do that. As well, these data are used at a local level with public health leaders in every community, connecting with their communities with the information those communities need. While we continue to accelerate our province-wide vaccine program, the foundation for all of us right now needs to be to continue to follow our COVID-19 safety basics.
那他也是强调了啊，就算我们现在已经快过半的人已经接种了第一针了，同时请大家千万别放松，一定要遵守我们的行为规范啊！一个室内戴口罩，第二保持社交距离，第三不要限制不必要的旅行啊，同时呢聚集啊，避免聚集，大家都出走走啊，就在室外的时候也要注意安全距离啊，这个也是他始终强调的，因为我们各方面都听到了啊，就算打了疫苗，有些人也获得了，当然这些例子很少，但一定是有风险，没有一个疫苗是100%的有效率的啊，就算我们打了辉瑞也好，莫德纳也好，95%、96%，那你100个人里边有5个、6个有这样的风险，也就是说10万个人里边也有500个了，所以这个就是很重要的一个指标啊，10万个里边也有5000个了，所以这个1万个里边有500个，所以这个也是很大的一个人群数字了。当然不是说你处在5%的风险里边就一定得到，也就是说一定要遵守，就算你不打疫苗，就算打了疫苗，都要遵守这些卫生习惯，一直到疫情结束。那么大家稍微可以放松一点啊。今天看到一个消息说，加拿大的联邦的副的首席医官说，乐观的估计，今年夏天会逐渐开放到这个正常的生活，但是这个是只是逐步开放，现在而且只是现在往这个预计而已啊。这个今天伯尼医生讲的这些没有很大的信息量。不像前几次通过他的说话会透露出一些信息量出来。
Thank you very much, Dr. Henry.
我估计他更多的就在自我表白。
passing on my condolences.
那么同时，卫生厅长也是对这个过去3天里边死亡的20个家庭和亲人这个朋友表示诚挚的哀悼。礼拜5到礼拜6是死了12个每一个卫生局下都有那么菲沙卫生局死的最多了
and 5 in Vancouver Coastal Health, and
I say to all of
those people because we continue, of course, to have restrictions that limit our ability to come together and to grieve. That we're thinking of the today that we're grieving with them. I wanted to also join Dr. Henry in recognizing national nursing Indigenous nurses day and all of the people working in our healthcare system, particularly right now in acute care. As Dr. Henry has said, 415 people hospitalized with COVID-19 right now in BC, and that number is less than it was this time last week when it was 474. But it is still extraordinarily high.
所以他说，就算上个礼拜稍微
也是470，over across the system in terms of base beds,
这个稍微人数下降一点，但是呢，这个住院率的空床率还是很低，占床率很高，我们的医疗资源还是面临着严重的压力我把数据都记下来了，这个住院的是415个还是51个，我应该是415个，重症监护呢下来了，变成150个人了稍微下来4个，上个礼拜4是154个。
vacant base beds.
那么它是现在大家汇报的这个是空床率。
occupancy rate at the moment. Our overall occupancy rate is 58.2% when surge beds are counted. That means, as I say, 101 vacant base critical care beds and 203 vacant surge beds. 15 surge beds are currently
那么周5到周6呢是596例新增，周6到周日呢是605个是略微下来一点，的确是略微下来一点。那么周日到今天呢是558个，3天呢是新增了1759个。 BC 省现在总计阳性呢是136100个，其中呢延安卫生局是325个，飞沙卫生局是1201个，岛上卫生局是50个，北部卫生局是52个，内陆卫生局是131个，这个加起来是1759例。
We received 135,600 doses of Moderna. That was early.
那么他说这个周末呢，我们又是到了30多万支莫德纳，而且这个是比预期更加早。
Next week, the week starting May 17th.
那么下个礼拜呢是5月17号呢，还会收到20几万支的这个辉瑞和莫德纳。这个也是远远大于预期的，所以这个5月份的第4个一周呢，又会收到27万这个辉瑞所以这样的话呢，上次就汇报过这个会大批的到货辉瑞和这个莫德纳，所以希望大家能够注册就先来注册。我们根据年龄呢，会马上给大家通知，你选择邮件通知就邮件通知，短信通知就短信通知。所以希望大家能够注册就来注册。
In our statement today, but total vaccine registrations in BC is 2,391,000.
那么现在已经有230多万个人已经来注册了，其中呢215万的人已经打了第一针了，所以大家可以看到吗？注册是230万。打已经215万，所以这样的话呢，只要你注册的话呢，马上就给你预约了，所以这个已经是很快了。那么现在看来，人的注册的意愿还不高，因为现在大家都可以来注册了那么还只有200多万的人注册，所以希望大家能够尽快注册，能够注册就去注册。所以这个是上个礼拜开始2位官员始终给大家来注册。
Finally, with respect to vaccines coming into the province, people will know that the Johnson & Johnson vaccine
那么从又送到了强生疫苗，这个是一针就解决的。那么现在还没到，他说我们现在还在等。
I want to say that COVID-19 continues to pose a whole community threat.
所以他也是说到了新冠病毒现在还是在对我们面临很大的风险，所以希望大家我们每个社区不要放松
For the vaccine to do its best work,
所以疫苗是最好的办法来对付这个病毒。所以特别是对那些易受攻击的这个脆弱的人群，那么希望大家呢能够所有的人都能够来打，就来注册来打。我们的目标就是6月底之前，让所有的省民都能够打上第一针疫苗。
It's a new road for all of us.
那么最近的朋友呢，最近呢开始打辉瑞的多起来了，好像听到有反应的还是有一些，这些反应呢就是集中在手臂酸疼，还有呢就是人有点虚弱。但是呢，都没有超过24小时。这个是听到的周围朋友比较多的一个反应。莫德纳我本人打的就是手臂酸疼，没有其他的。谢谢你这边，也谢谢你谢谢你的评论和支持那么，所以这个请大家不要有顾虑，相信有一部分人顾虑说，这个打了疫苗之后有这样或那样的反应。那么从我个人本身周围的朋友听到的、看到的和本人我自己都没有特别大的反应都是无非就是反应有很多人就说我打了很兴奋了，好像本来要饭也少了，现在饭量也大了，有一种反应。还有一种大多数反应呢，就是说手臂好像有点酸我本人是第二天也有点酸，但是24小时以后就没有感觉了，一点感觉都没有了。那么其他一些打过辉瑞的人呢，会有一些这个无力。听到过，我是听到过有一些无力的感觉。
A reminder to reporters on the line, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. First question, we go to Binder Sachin, CTV.
With restaurant workers now getting vaccinated in Metro Vancouver, right after the long weekend is when that immunization should be kicking in. And I know we are still seeing hospitalizations at a high rate, unfortunately deaths this weekend as well. But I'm wondering, with them vaccinated, does it open the door to easing restrictions on indoor dining? And if not, what else are you looking for before that could happen?
那么他说了，随着疫苗的注射普及越来越高，那么堂吃是不是慢慢可以解禁啊？那么这个也是他说主要是因为这个低卢平原的这些川天的员工啊，他们都开始打疫苗了，都有这个政策了啊。我听到周围的朋友，一些上班的人都让他们打了。那么他说，我们随着这个，我们已经是看到了，也在研究这个。
To transition, and we
如
will
何
have
过渡
many more
慢慢
details
放
on
松
those in the
那么
coming days.
具
But
体
certainly
的
one of
措
the
施
things we want
过
to
2
get
天会
back
给
to,
公布
as
现
soon
在还
as
没
it's
决定
safe to do so
如
is
果我们
indoor
决定
dining. We know how
开
important
放
that
堂
is
吃
for restaurants, but it's also an important
那么
safe
对餐
place
厅来讲最
when
重要的
rates are low in our community, and when people are protected through immunization. So yes, we will be talking more about when the restrictions that we have in place are going to be lifted and what that will look like.
所以他也是说到了，我们主要是考虑接下来的几个礼拜是否慢慢解禁现在所有的这些措施。那么这个也是我们逐步考虑、逐步开放的啊，不是一下子就开放。我们要具体情况具体分析，因为这个目前所有的严格的禁令一直到这本个月的长周末结束。
And so with Pfizer being approved for everyone 12 plus, why can't all restaurant and grocery workers get vaccinated now, even the ones who are younger than 18?
Yeah, so this is that was just approved for use by Health Canada last week. So we have had ongoing discussions and more of them today
那么这个记者说了，就是18岁以下的这个孩子打疫苗的问题。他说这个呢也是上个礼拜刚刚联邦这个取消开放。那么我们 BC 省具体的还没有马上这么快。那么现在呢，12岁到17岁的这些孩子们的青少年们的疫苗的注册的这个程序呢，我们过几天也会公布如何给他们接种疫苗。
Talking to Saskatchewan about its reopening plan. It's the first province to release sort of a 3-stage gradual reopening by early July that would be based on the number of people in each cohort who are vaccinated. What is BC's
那么他说那个 Saskatchewan 省呢是全加拿大第一个宣布恢复第3期到7月底7月初之前恢复第3期的这个慢慢开放的措施。那么 BC 省什么时候公布因为现在大家都慢慢开始他说我们也是对 Saskatchewan 的计划这么早公布呢有点吃惊啊，我们都是同行同学同事之间都有这讨论。BC 省也有这些计划我们当然了也会跟政府在讨论
by the deputy for the premier, but with all of government and our stakeholders for our restart 2.0, if you want to call it that.
那么他说如果你们这么说就是我们叫重启 2.0 计划。那么我们主要是考虑到疫苗的接种率才考虑到这个。那么现在呢萨省和英国的开放的这个计划都是走在我们前面，使得我们 BC 省能够看到这个他们的模型走势，使得让我们有所更多的借鉴。所以我们都在考虑都在观察。
Of our pandemic response. The number one goal is to reduce morbidity and mortality. So sickness
那么他说我们应对这个疫情的最重要的第一目标就是要降低死亡率这个是最重要的同时呢降低这个重症率。所以这个是我们这个应对全球流行病新冠病毒的这个第一目标第二目标。所以现在看到这个重症监护我们不希望看到上去，不希望看到住院人数上去。所以所有的因素我们都要考虑进去。我们当然已经讨论了很多了细节都在讨论了。
Katie, do you have a follow-up?
已经讨论了，其实 Saskatchewan 走得比较早，他们都宣布了。
Will the province be releasing more detailed data on transmission or infections inside schools and also daycares? Because we haven't really seen much around daycares. Like,
那么 daycare 的传播情况以及学校里边的传播情况你们都没有详细的公布。
So, as I've said many times, we don't have the type of information that I think everybody would like to have, which is exactly who transmitted to who in every school and every daycare. We do have some higher level information, and we've had some deep dives that have been done in both Vancouver Coastal and Fraser Health in particular that we've presented to people. We do have an overall number of people who work in the childcare sector, and we have had some small outbreaks and transmissions in childcare centers, and that is one of the reasons why childcare workers have been prioritized. And I think that's a really good point. Childcare workers and
所以他说这个学校的老师以及 childcare 的这个工作人员先让他们那个打疫苗是很重要的一点。
So I would really encourage
所以
people who work in the childcare
一定是鼓励大家，特别是那些学校的老师、教职员工以及childcare 的这些职员们能够去打这个疫苗就打疫苗。现在正好是
Please go and get vaccinated.
全省的，全你们去打，
In terms of
去
the
打疫
data
苗，
that
请
we
你们
have,
去打。
unfortunately, our surveillance data is limited in both those areas.
所以他说
we will present
也
and
很抱
continue
歉，
to
我
present
们
what
的
we
这
do
个
have.
监控数据呢，对这两个
Next question, Richard Zussman,
你提
Global
到的
News.
场所的数据也都是很有限，不是太详细。
Saskatchewan's plan is very
其
much
实
based on vaccination, just
他
like
之
Katie
前
was
我已
asking.
经
You
说
mentioned
过
that ours
了，
would
这个素里
include
做了一个
other
调
things other than
查，
vaccination.
延安
Can
卫
you
生局做
explain
了
what
调
that
查，
is?
分
And
别
do you
是
believe
去年
that
的
having
9
a
月到 12 月，
reopening plan
以及
like
今年的
this
1月到
will
3月
provide
那个延安
impetus for people to go get
做了一个，
vaccinated,
然后呢
or something
飞
for
沙做
people
了一个
to， look for
就是做了一
specifically
些。
around when they can do certain things like, you know, go to an event or go to a library with higher capacity. Do you think it would provide some additional support for people towards that goal?
Well, I think there's really two things about it, and we want to look at where where it has been most impacted, and of course, we look at food and restaurant and tourism and those sectors, but we also look at where things have worked really well. And here in BC, we've kept most retailers open, especially small retailers. We've been able to keep many businesses functioning safely with the COVID safety plans. So a lot of our work will be focused on those sectors where there needs to be specific things, and then we'll be looking at the 7-day rolling average of cases, the information that we present regularly that's on the BC CDC website. We'll be looking at hospitalizations, people in ICU. We'll be looking at the morbidity and mortality. How many people are in hospital? How many people are thankfully, fewer and fewer passing away from COVID-19. So immunization does two things. One, it has a personal benefit for me. I'm protected from my own personal health, but it also has a community benefit. So immunization rates are just one of the factors, but a really important factor. And yes, that we will be looking at a vision of where our post-pandemic world is going to be, recognizing that this virus is going to be with us for some time.
同时呢，也要意识到这个病毒一直在与我们在一起，在社区里边存在，但没人知道还要存在多少时间还会以什么形式存在那么这样的话，我们是希望每一个人都能够免疫起来，得到疫苗免疫起来。
Missed in our lives over this past year. How do we do that slowly? Recognizing that not everybody's risk tolerance is the same.
所以同时呢，我们也不希望每一个人都去冒这个风险因为我们这个重启，所以呢，同时呢，也让大家慢慢就适应能够慢慢的不要觉得太难受那么慢慢开放。那么大家可以看到英国是他们是在走在我们几个月之前，那么现在呢，他们在慢慢重启你可以看到了。所以只要你重启的速度一快这个病毒马上就传播。
Once we are all protected, are relatively protected, and then what we can do as a
所以他
community,
说，
whether
只要
it's in a workplace,
大家
whether it's
都能
in
够保护起
having
来，或者
social
相对都
gatherings
保
at
护
a
起来
larger
了，
amount.
所以呢，
And
我们
I
就
think
会慢慢开
it's
放
safe to。say
那么
that
他强调了，
we
大
can
家听到
be
了吗？他就
looking
说，
at
即使
be
堂
going
食
up to
禁止了
larger， numbers
还有一
of
些
people being able
活
to
动禁
gather
止
for
了，
important
但是呢，
ceremonies.
所有的
Last
零
summer
售
we
店
had
没有
the
禁止
limit of
这个
50, and
你们的
that
生
was
活
a
没有
good
很大的影
transition for
响
a。period of time. Then we
那
can
么
look
同
at
时呢，也
larger
是说到
numbers.
了这个
So
限制呢
it
是
is,
10个人，慢慢又
more
恢复到
details
50个
will
人
be。coming,
同
of
时呢，
course,
再
but I
慢
think
慢
it's
开放，
important
所
that
以
we,
只能是
there
他
is a
说
vision
开放的
for
太
us
快
getting out of this，
病毒
pandemic
马上
and
就
getting
会
back to those
又一下
important
子窜上
connections
去
in our lives.
所以这个也是那么卫生厅长来做一个补充。
I know you'd expect me to say this, Richard, but I think it's important to live in the present as well. Right now, it's very important. What we've seen over the
所以
weekend
他说现
is
在是
better
很
than
重
what
要
we
的
saw
大家可以
before.
看到
Still
这个周末已
596,
经比之前好一点了都是596，605个那么住院是415个这个重症监护是150个。
Saskatchewan's plan and one
那么大家可以看到沙省有这个开重启的计划了。
very much in the present right now, and that means following public health orders,
所以还是请大家能够遵守我们的卫生指南。
If we can do
同时呢，
that
大家
now,
能够
it
注
opens
册
up
来打疫苗
opportunities later. But we got to
那么
remember the present
慢慢
is
我
not
们
the
都会有
only
机会
present
能
of
够
the
重
orders that are
启
in。 place, the guidance that is in place, sticking
所以希望大家能够落实到位我们所有的卫生行为指南能够遵守我们的行为指南。
Richard,
那么这样的话，我们就会重启，顺利重启。
You mentioned positivity rates. We're seeing different levels of positivity and different caseloads in different parts of the province. Is there any way, as part of this reopening, that we would have a regional approach, i.e., people in areas of lower transmission would be able to do things that places with higher transmission would not be able to do? And to Minister Dix's point, he says living in the present. How much heads up will you give to restaurants and other industries who will need to hire people back as they move back to a transition to normalcy?
Yeah, so that is something that we have ongoing consultations. My office has met every 2 weeks pretty much for the last year with people like the Restaurant Association. So those are ongoing discussions. We understand for many different industries there's a lead time that can be weeks to months depending on where we're going. So yes, we will continue to have those consultations and give people the lead time that they need. I'm sorry.
他这个记性不是很好啊，我们的。
But you had another question at the beginning, which I've lost. I'm sorry.
Yeah, regional. Whether different restrictions would be in different places based on.
I think.
他说不同的地区
we have learned
有不同的这个禁令。
We've tried on 2 occasions to do things regionally and recognize that we are connected across this province and across this country in many ways.
上个礼拜开始加强了旅行限制的检查。
Is a virus that spread from people to people, and our risk goes with us. From where we come, and we take it to where we're going, and we take that risk back with us. And we can see, we only need to look at my colleagues in Nova Scotia right now to see that things can change very, very quickly with this virus. So we have always, we've maintained an approach of doing it together here in the province, and I don't see that changing. We've seen that this virus can cause dramatic effects in many communities across the province, and we're not yet at the point where we have enough immunity across the province that we can do things differently. So a consistent approach has worked for us and will continue to work for us. If we learn new things and if we get to a place where there's evidence that supports doing things differently in different communities, then we will continue to look at that. But right now, I think we can expect to go through this next phase together as we have been for the last year and a bit.
Next question, Marcella Bernardo, News 1130.
Thank you, Dr. Henry and Minister Dix. I'm going to start off by asking you about the timeline for second doses. And if you could explain why people who received their first dose of vaccine in the Vancouver Coastal Health Region are now being told to make sure they're registered if they book their first appointment by phone before April 6th, and what outreach is being done to ensure that they get their second dose before that 4-month mark.
Yeah, so as you know, we increased the dose interval, and at that to make sure that the strategy is to make sure we can get as many people as possible with their first dose as quickly as possible. And as in a time of limited vaccine supply, that was our most efficient way of getting community protection as quickly as possible. And many people are now coming up to that 4-month period, and what we have done is loaded the information about those people into our provincial system. So we've always had a provincial immunization registry. This is something that I fussed about quite a bit, so that we know every single dose of what vaccine went into whose arm. So we know who has Moderna, who had Pfizer, who had AstraZeneca. But our registration system has names but not contact information necessarily. So we are doing outreach to, it is a lot of people in long-term care and in many of the First Nations communities that had immunization by community. You will be contacted by your community. We are going back into long-term care homes and providing second doses for those who have not yet had them. Those things have started now as we've reached that point where many people are at, we started it at 13 weeks versus 16 weeks to make sure that we can get those second doses prior to 16 weeks. And healthcare workers were first in line, older people were first in line, and so we'll be reaching out to them and have been over the last little while. You can see that the numbers of people with second doses is starting to increase, and starting next week that will go up in much larger increments as we reach that period of time when we started to get more vaccine at the end of February. So yes, those are happening. If you were somebody who got your dose, the most efficient way to do to get your second dose is to register.
所以对你们来讲，对大家来讲最有效的打第二针的方式就是希望大家现在就去注册。当初的时候呢，注册，因为我们现在这个系统呢是4月6号以后启动的，那么4月6号之前这个没有这个注册系统，所以呢还是用传统的方式，也就是数理是数理的方式，沿岸卫生局是沿岸卫生局的方式，飞沙卫生局是飞沙卫生局的方式，那么他们会主动联系你。那么现在呢，因为我们都有这个注册系统了，那么他们呢联系起来我们很方便，很方便，而不用到这个养老院一个一个去，一个一个联系打电话了。
Surveillance data. We have from the very beginning shared that with a wide variety of our team members. There's over 100 people that are on our listserv for that information, and then it gets loaded up onto the BC CDC website. So all of that so-called leaked information is information that we've been sharing that's publicly available and more. You know, the VOC report is on the BC CDC website. Our adverse events following immunization report is on the BC CDC website. What is new, and what I've said today we are going to post publicly, is replacing the LHA maps with the heat maps now that include, for most areas, community health service areas. As we've had more cases in the last month, 6 weeks, we now can go down to a smaller geographic area, and those maps will be posted on Wednesday. They were approved by me to be posted about a week and a half ago. We were trying to get the process so that we could have them more interactive, but that has not been able to be pulled together quite yet. So we'll be posting the static maps, and then as we develop the interactive system, we'll post that as well. So that information is there for people, and we have been trying to get it out as widely as we possibly can. So I want to reassure people the first and primary role of the surveillance data that we collect is to make the best decisions from public health that we can, and that means sharing it widely with public health professionals, with researchers, with scientists, so that we best understand it. That's the primary purpose of the data, and that's how we use it at a local level, on a one-to-one level with public health, and at a provincial level to make provincial decisions about our program. And then we post as much as possible publicly so that everybody can see the data as well.
他始终强调了这些数据的使用，这些数据的这个分享。 始终强调了这些。今天的虽然没有正面去回答上个周末的疑问啊，那么也就是说到了，他说这个数据的不同的程度的使用这个如何的各个层级的如何使用研究以便这个公卫决策、公卫工作的人员的做更科学的决策更符合事实的、更科学的做决策以供给大家，同时呢公布出来，报告给大家。
Publicly, those maps in question will be provided publicly, and over time, we provided more and more information.
所以这个卫生厅长也做补充了就是提供了很多的数据。他说我们及时的也是每一天都给大家更新在我们的这个网站上同时呢每个礼拜也会给大家公布这个我们这个更新一些其他的一些数据。
Was information about outbreaks in long-term care. That information
同时呢，几个月前大家都看到了我们及时公布的长期护理院的爆发的情况。
Equally, information on PPE.
那么同时我们也是给大家公布更新这个个人防护服、卫生设备等等的这些计划以及采购量等等。
Is the strong support of the Premier for public health in what is a pandemic that's unprecedented in our time. And I would say that here in British Columbia, our mortality rate less than half of the national average.
他说我们 BC 省的死亡率远远低于国际上的这个平均死亡水平。死亡率水平
我们
BC 省的这个死亡率是真的是，他说跟美国比起来是低得很。
It's been a significant effort, and I would say that effort reflects, I think.
所以他说，他说我想表达的就是所有的这些努力才能得到的这些成绩，反映出了这个这么低的死亡率以及伯尼医生和他的团队所有的辛勤的努力和工作。
We learn from those challenges, and we just keep going forward. And you've seen us adapt consistently through this pandemic, and we're going to continue to adapt.
大家听明白了啊，这个今天反反复复在讲这些，所以他们其实是在面对这个媒体及公众的质疑，也就是上周我刚才说上周五还是上周六有一个英文的质疑，就是他们这个数据不透明和这个瞒瞒这个数据或者是实际的数据远远大于现实的。但我是觉得呢，你就算隐瞒这个住院率和住院的人数和这个重症监护以及死亡的人数，这个是实实在在的。所以那你就隐瞒了什么？有可能就隐瞒了无症状的感染率了。那无症状感染率或者是不住院的感染率了，无非就是隐瞒这些了。那么在他们这个加拿大和美国的这个医疗环境语境里边，不住院的就不算生病而已这个是太不一样了。所以我觉得他们在反反复复强调这些数据、这些分享，这个如何取得、如何分享、如何决策反反复复在解释。那么最后一个问题了，我估计还是CBC 的，还要讲法语。
Yeah, Dr. Henry, there are now almost 1.5 million British Columbians who are more than 2 weeks past their first dose. And while it may be some time yet before we can, say, gather in large crowds, when is guidance going to change for people who've received that first dose for more than 14 days now, at least, in terms of what they can do now? For example, can two people who've both received that first dose several weeks ago spend time together inside?
Yeah, this is not 100% vaccine, and we've seen that in other jurisdictions around the province. We've seen that in long-term care. People can still get infected.
那么这位记者问的就是第二针的问题。第二针和第二针呢，他说已经BC 省已经有100多万的人他们的第一针已经超过了这个时间了，应该打第二针了。那么所以他也就说到了，他说只要先打第一针，打第一针了之后呢，全省的这个 个传播率就会下降很高，下降了很多很多。那么同时呢，我们现在呢，因为疫苗的供应开始多起来了，所以我们已经开始让更多的人开始打第2针了。所以因为同时呢，我们也要让更多的人在短时间里边打上第1针。
So right now is not the time to take those risks.
所以现在呢，不是我们不认为这个是很大的风险，因为打第2针因为第1针打了之后还是有风险嘛，所以他说现在不是考虑这个打第1针的人获得的病毒的风险。
So far, it seems as though no fines have been handed out. Only a handful of cars turned around. Do you consider that an indicator of success?
I do, and
他说这个现在高速公路上的这个设点检查，非必要旅行的这个点，你们有没有罚款？这个方法有效吗？
I think it was something that we needed to put in place to remind
他说我们所有的这些措施呢，只是提醒大家不要那个大规模人员聚集，不要有非必要的旅行尽量避免。这个只是提醒大家，也是让大家延缓做这些事情。所以这个是对我们大家来讲很重要的，就是希望把传播率下降。所以这样的话呢，我们才能够面对疫情后的生活如何开放如何让我们恢复到正常的社交我们的社交文化正常化。所以我也希望我们能够尽快的恢复到这个之前的生活。我们会有这个详细的。他说我们所有的这些措施不是为了罚款这个我们只是希望大家不要旅行非必要的旅行就不要做了这个所以我们不是以这个罚款为目标的。所以这样的话呢，我们能够延长扩展我们的措施落实到位。所以这样的话呢，大家可以看到了那个在各个检查点现在提醒大家，现在不是旅行的时间所以这个信息已经很清楚的告诉给大家了。所以我也很感激大家特别是那些工作在第一线的工作人员他们使得我们的生活每天依靠能够往前走。那么他现在说法语了，我把过去的3天新增的数字再给大家复述一下。周5到周6呢是新增596个，周6到周日呢新增是605个，周6到周1是558个，3天呢新增的是1759个。BC 省现在的总数呢是到了136100个整，其中呢延安卫生局3天新增325例，飞沙卫生局3天新增1201例，岛上卫生局3天新增50例，瑞鲁卫生局3天新增131例，北部卫生局3天呢新增了是52例。那么这样的话呢是6、7、9，对了1759例。那么到目前为止呢，住院今天呢是415例，这个比上星期4 457例下降很多。那么重症监护呢下降了4例，上星期4呢是154，今天呢是150例这个也是小有下降。我把这个声音关一关。好，那么同时呢，很遗憾呢，过去的3天呢，新增了20例死亡，这个是很遗憾的。那么现在 BC 省累计死亡总数呢是到了1622例了。到今天目前为止呢，全省呢已经有2159300个人打过疫苗了。那么这个呢是很重要的一个指标。上星期42位官员已经给大家很兴奋的说，一个重要的里程碑就是过200万了。那么现在呢是215万9千，也就是216万了。 216万呢，也就是说从上星期四到今天4天里边打了16万也就是一天是4万左右这个大家我也听朋友说过这个上周一这个会展中心排长队打疫苗。那么各位观众，今天的新闻 BC 省的新冠疫情的新闻简报呢，就给大家转播到这儿，我们星期四再会，也祝大家有一个安全开心